When I was about 13 years old, a very good friend of mine who is from this area as well, she died from bone cancer. And when she was in hospice, here in the hospital, I was able to spend time with her. And honestly, that's when I decided that this is what I wanted to do. When I was actually leaving residency to come back here to Ortonville, one of my attendings said to me, "You're gonna go be a real doctor." Delivering babies and taking care of babies is probably my favorite part of my job. I would really miss taking care of their family members and knowing families and getting to follow people throughout their lives.
So how are things going?
Good.
Good. How are you feeling?
Good.
It's great to be able to do what I can in an area to help people, so. Rural healthcare is struggling. You know, small towns are really struggling to get and maintain good physicians and other healthcare workers, including, you know, nursing and all, you know, all across the board. We in this area, fortunately for us, I mean, I don't even think a lot of people understand how fortunate we are here that we have continued to be able to get people coming back here. I just think we're all very fortunate to be part of this.
My experience, the people, my folks and Marine's folks, the hospital has been excellent. They have taken care of people like you wouldn't believe.
Well, I feel it's an excellent team. With all the problems that I had and the seriousness of the problems, to even be here says a lot about their professionalism. It was the 23rd of July, and I was coming in for my checkup to check my blood thinning. And I had stopped in to register, as I always do.
You came in and I said, "You better sit down. You look like you need to sit down right away, Scott. You look a little peaked."
And then I went down.
I called over there. I said, "I need somebody over here stat."
I do not remember anything.
Say within seconds, they were here and taking care of him and taking him to where he needed to be, which was over in the ER.
You saved your life, Scott.
Yes, they did. I'm very happy about that and proud of what they did.
When I had my first heart attack, 93, my heart stopped twice, and they got her going again. And now the new hospital is better yet, very much better. I've been a couple other hospitals down the road, and nothing compares to this one.
You whacked your hand, and
Oh, I did that yesterday, skinning, by fixing on the machine.
so the guy's accident prone. A frequently asked question I get when I visit other places is, how do you guys do it? How do you manage to keep the 5 and 6 physicians and all those outreach and build a new hospital, have dialysis, have a new clinic? How do you guys do it? And my first answer is, if it wasn't for the foundation in the last 20 years, I don't think we would be where we are right now.
The importance of it can't even be put into words. I mean, what they have done to try to recruit people.
The foundation played a key role in recruiting me here because they're able to give me a signing package. You know, the way it is now with the debt loads that, you know, medical students and other students, you know, obtain, you really do need loan repayment options to recruit people. You know, having this foundation in place really played a large role in me coming back.
I worked with the foundation and received a grant from them that they would give me a certain amount of money to put toward my medical school each year, provided that I then came back and worked for a certain period of time after that, and that helped tremendously. And I just think that speaks, you know, so highly of our healthcare, our area, and especially our foundation. They understand the importance of getting people back here into rural areas to provide good medical care, and that's what they do, and it's amazing.
Well, look what they've done. Look at the money raised when this hospital was built, and they help any way they can.
You know, my only regret is I wish we'd have started the foundation earlier.
How we doing today? I told you I was sore. A little bit.
We can't take anything for granted. You know, we have to keep going forward. We have to keep providing up-to-date medical service. We got to keep hiring people who are good at taking care of people. And so this is a never-ending struggle that we cannot take for granted, even though, you know, we're feeling pretty good about ourselves right now, but we can't rest on our laurels.
My grandpa come over in 1879 and he donated 3 acres for the church and the cemetery in Rosen. Beautiful church, up on top of a hill. I was always kind of proud of the church being on my land. So that's where that all started, I guess.
I was born here, my folks were here, and then I met my wife. We were together 2 months short of 60 years. When I was in business, the community was helping me. Look at the business I did. I owe the community. I thank God for his help to me. I wanted to help people. I still do.